C5, C6 disc bulge, C5, C6 bulging disc. Are you struggling to turn your neck without pain? The burning, tingling down your arms, the numb fingers, it's exhausting, frustrating, and feels like there's no end in sight. But you've probably tried everything, physiotherapy, injections, massage, even chiropractic care, only to find the pain lingers for months or even years. But here's the thing, most treatments don't target the real cause of a C5, C6 disc bulge. That's why they fail. The truth is, a bulging disc in your neck doesn't mean you need surgery, and the right approach can get you relief in weeks with over a 90% success rate. In this video, I'm sharing a proven 3-part protocol that's helped thousands of patients. By the end, you'll know exactly what kind of treatment works, how to start seeing results fast, and how to finally break free from the pain. Let's dive in. Hi, I'm Dr. John Zawanka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and surgery. I upload a new video every week. In addition to that, I've created a free Health Vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it in the link in the pinned comment below. A C5, C6 disc bulge occurs in the cervical spine, so that's the part of your spine in your neck. Between each vertebrae is a soft gel-like disc that acts as a cushion. It allows for smooth movement. Most importantly, it provides space for the nerves to actually come out. That's important because when that disc bulges out of its normal space, it can press on nearby nerves, causing pain and other symptoms. C5-6 is one of the most mobile parts of the cervical spine, making it highly prone to wear, tear, and injury. Common symptoms of a C5, C6 disc bulge are going to include neck pain, often worse with movement, radiating pain down the arm, known as radiculopathy, tingling, numbness or weakness in the hands or fingers, often the thumb and the index finger, difficulty with everyday activities like turning the head, holding objects, or sleeping comfortably. Severe cases can lead to loss of grip strength, because remember that nerve controls everything wherever that nerve goes to, or coordination, making early treatment essential. The most common causes of a C5, C6 disc bulge include disc degeneration. So that's going to have degenerative changes in that disc. That disc is actually going to wear and tear, causing it to lose hydration and flexibility. Trauma or injury, so that can be whiplash, sports impacts, falls, especially car accidents. Repetitive strain or poor posture, so spending hours hunched over devices, at a desk, or in other positions that stress the neck. Now, what is the 3-part approach? Chiropractic care is the first part of this protocol. Adjustments help restore proper movement and alignment in the cervical spine, which reduces pressure on those bulging discs and the surrounding nerves. By improving joint mobility, chiropractic adjustments create an environment for the disc to heal naturally and reduce symptoms like pain and stiffness. Now, it's important to note, not all chiropractors are alike. Different chiropractors will take different approaches. It's no different from medical doctors being different, or dentists being different, or mechanics being different. In our center, we practice something very specialized called neurofunctional chiropractic, where the goal is not just to take that pressure off the nerve. We want to restore nerve function, and we want to restore normal movement and function to that entire joint and nerve segment. The second part of this approach involves specific exercises designed to improve neck mobility, restoring stiffness, and restoring a healthy range of motion to build strength and stability in the cervical spine, which further prevents strain on that affected disc, to relieve nerve-related symptoms like arm pain, tingling, and numbness. The exercises can include everything from neck range of motion movements to keep the cervical spine flexible, light stretches to ease muscle tension and improve overall posture, isometric strengthening exercises to stabilize the neck and support the healing process, nerve glides to improve mobility and function of nerves that are impacted by that C5, C6 bulging disc. When combined with the other steps in this protocol, these exercises work to reduce pain, restore function, and protect against future injuries. Now, again, different health professionals will do this differently. Are you looking for standard exercises for the average person, or for exercises specific to you? In our center, we've worked with some of the world's best athletes. We focus on something called neuromuscular re-education, which essentially is getting your brain to start using these muscles properly again, in addition to all the things that we just talked about. The third part of our protocol is spinal decompression. Now, this is not traction. This is not hanging upside down on an inversion table. This is important to understand the difference, because there are still some people who believe they're one and the same. Unfortunately, that's just not up to date with any of the science that's been around for quite some time. Spinal decompression for the cervical spine is often overlooked by many physicians, chiropractors, physiotherapists, and surgeons. That may be one of the reasons, if they think it's the same as traction, but it's a critical component for treating the C5-C6 disc bulge. This non-invasive therapy gently decompresses the cervical spine. So that goes beyond stretching. Decompression means you're getting negative pressure inside the disc. That creates space for that bulging disc to retract. It relieves pressure on the nerves and relieves pressure on the disc. And it also rehydrates the disc. A normal disc is 86% water. If you have a degenerated disc or a bulging disc or a herniated disc, you do not have 86% water content in that disc, and drinking more water is not going to magically bring that fluid back into the disc. That's what true spinal decompression will do. Most patients experience noticeable relief within the first few weeks, with significant improvements in mobility and pain reduction by the end of their treatment program. At our clinic, we've taken spinal decompression to the next level. When we treat patients with a C5-C6 disc bulge, we use non-surgical robotic laser spinal decompression. There are only 12 of these systems in the world. We have the only one here in Ottawa, Ontario, Canada. The advanced technology essentially combines spinal decompression with Class 4 deep tissue laser, promoting faster healing and better outcomes. Please make sure to subscribe to my channel and keep an eye out for my next video, where I'll take a deep dive into non-surgical robotic laser spinal decompression. I'll explain how it works, what makes it so unique, and how it speeds up healing, relieves pain, and improves C5-C6 disc bulges quickly, without surgery or drugs. If this video gives you clarity about your condition and its treatment, hit the like button and share it with someone who needs it. If you have any questions about the treatment of C5-C6 disc bulge, drop them in the comment section below. I'd love to help in any way I can. A C5-C6 disc bulge is often linked to disc degeneration, but did you know there are science-based supplements that can help restore disc health? As the author of the bestseller, The Science of Vitamins, I've got a video that breaks down the top supplements to restore disc health. Go check it out next to learn how to support your recovery.